Hey there. So this week I wanted to cover a topic that quite a few of you have been asking me to cover for a while now, and that is the topic of OCD and OCPD, which stands for Obsessive-compulsive disorder and Obsessive-compulsive personality disorder. And although they've got slightly different definitions, they are quite similar in the etiology in any case. So for this video I wanted to firstly define what they are, then talk a bit about my own personal experience with them and what I've seen in other people, and then what you can sort of do to try and get around them. So what are OCDs and OCPDs? Well, if you divide it in terms of the words of what they are, so obsessive, the obsessions that you get are these sort of recurrent intrusive thoughts, feelings, and they're the things that cause you emotional distress. Now, what could those things be? Well, if you're undergoing treatment for an eating disorder, the things that can cause you emotional distress is the refeeding, obviously, because you've lost control in that sense. But other things, if you're not in treatment, other things that are spiraling out of control in your own life, whether it be relationships, schoolwork, occupation, any of these things can cause these recurrent thoughts that essentially don't make you feel good and make you feel more anxious. So what are the compulsions? Well, the compulsions are the repetitive behaviours that you undertake in an attempt to try and alleviate that anxiety. And these compulsions, they don't tend to be very helpful in the sense that they can be quite weird and they can go on for a very long time. Now, OCD is different from OCPD in the sense that it's just called ego dystonic, and that essentially means that the behaviours that you perform don't quite fit with who you are, your own personal values and your own attitudes. And I'll talk a bit about that later. Whereas OCPD is called ego systonic, which means that the behaviours that you perform are consistent with your own beliefs, your own values, your own attitudes. And so let's move on about my own personal experience. I believe that I had OCD rather than OCPD while I was undergoing recovery in Rhodes Farm, and the reason why I say it's OCD is that I was doing things that didn't really hold any value to me. The first of which was my very abrupt need for cleanliness. I would before meals we were allowed to go to the toilet, because an hour after the meal you weren't allowed to go to the toilet for an hour due to the risk of purging, and I would obsessively wash my hands because I wanted to make sure that there was nothing dirty on my hands, just in case I would have to eat something with my hands at the meal, and so there was that issue of bacteria, but also I could have touched anything beforehand, and that thing could have been, let's say, oil, and if that oil went on my food which I was touching and I was eating, I was essentially eating more, if you see what I mean. And this got to the extent that I would wash my hands obsessively before, but then as the anxiety got worse and worse, because I wasn't dealing with it head on, I was ultimately having to start washing my hands more and more throughout the day, and that got to the point where I remember there was like massive fissures in between my knuckles, and that they were really deep cuts, and they were really painful actually. And because I would then wash my hands again with this perfumed soap, it would cause me absolute agony. And the healthcare workers, they hadn't seen it like that bad before, so they thought I was allergic to something for some time, until it eventually got realised that I was washing my hands like this, and they stopped me. Now, I didn't. I mean, I don't think I had OCPD, but I definitely know some people who did. And OCPD, they can be behaviours that necessitate the need for order, necessitate the need for control, those sorts of things. And for example, when I was undergoing recovery in the Priory last year, there was a girl who had definitely had OCPD, and she wanted the control of not undergoing any sort of change, if you see what I mean. So she'd have to be in the same room for the whole of her treatment. If she had to move to a different room, she would really go crazy. And I mean, there were so many other things that she necessitated the need for control for, and also the need for order. Everything in her room was color coded. Everything in her room was sort of in its rightful place. And actually, now that I think about it, I know someone who might have OCPD without an eating disorder. In my college, I'm not going to name any names, but in terms of the necessity for order and control, if you go to his room, if like say this is a desk, everything would need to be in the right direction, if you see what I mean. Everything needs to be parallel to one another, and if it's not parallel, the only other direction it could be is perpendicular, so at a right angle. And it's quite odd because he's quite normal throughout the year, but as soon as it turns to exam term, when the stress, i.e. the obsessions, the recurrent intrusive thoughts come in, he starts performing these behaviours again. And for him, it's quite benign in the sense that it only happens for a few weeks, and then after that, it's fine. But OCD can be quite severe, as was the case with my hands because they were bleeding all the time. But some OCDs can be quite violent. So they, in my opinion, even if they are benign, they do need to be acted upon, because even though they might appear quite benign at the start, they can they can self-perpetuate into something that's quite awful, and also they can evolve to involve different behaviours that could invoke harm on yourself. So what did I do? Well, the first thing I did was not really under my control, and that was when the healthcare workers realised what I was doing, they stopped me. And if you have an OCD that's not currently being recognised, the thing that you could do that would sort of mirror that would be to tell someone what you're doing, and you're letting them know voluntarily the things that you're doing that are really bothering you. And if you can say if you're noticing that I'm doing this, don't you can ask them to stop you, but you can also ask them just to give you some support rather than them just saying stop. Those are the sort of times where the thoughts have gotten so bad that you feel the need to perform this behaviour. So why not try and make you feel better rather than just stopping you when you're all built up with anxiety. It's the anxiety that needs to be acted upon, and that can be acted upon just by talking to someone, for sure, definitely. Another thing that I know was quite helpful was undergoing CBT, which is cognitive behavioural therapy, and CBT is one of these new types of therapy that's being used for so many psychiatric illnesses, and the reason why is because it is actually quite effective. You can do CBT at home if you wish, and I'll put some links in the description box below for some some worksheets that you can have a look at, and you can fill them in, and just what they try and do is they try and make you identify an abnormal behaviour. They try and then identify the potential the root of the cause of that underlying behaviour, i.e. the obsessions, and you can then sort of work out potentially healthier ways of dealing with that anxiety rather than going fast tracking to the thing that you ultimately don't want to be doing. If you don't want to do it on your own, you can definitely just go and speak to your local healthcare professional. In the UK, just go to your GP. I'm sure it's the same in the US, but you might have to pay. But even if you have to pay, you ultimately have to think do you want to be doing this for the rest of your life? Because OCDs, they can be quite, they can make you feel quite isolated because you want to perform them on your own. Because you know in yourself that it's quite a weird behaviour and you don't want other people seeing you doing it. So, just try and act upon it. Be brave, and you can do it if you put your mind to it. The last thing that I've seen people doing is taking SSRIs, which is a drug that increases the amount of serotonin in your brain, and this is because depression, eating disorders, they're all linked to a reduction in serotonin. If you are thinking about going down this route, it's not something I've done personally, but if you are thinking about it, it should be more of a last resort option. In my opinion anyway, because there are so many other options that don't need pharmacotherapy, and because pharmacotherapy can have side effects. If you are going to do it and you've just started, don't stop in the first 4 weeks. That's all I can say, and that's because SSRIs take about 4 to 6 weeks to become effective. So if you're taking it and thinking nothing's happening, I'm going to stop, don't do that, because it does take some time. The other drug that I've heard being used to treat OCD and OCPD is a drug called clomipramine. This is a tricyclic antidepressant, and although it has a different mechanism of action from that of SSRIs, the ultimate aim is to increase the amount of serotonin going through in your brain. It also increases the amount of other neurotransmitters, and that's thought to be related more to the side effects of these drugs. And compared to SSRIs, tricyclic antidepressants have a somewhat larger side effect profile. And SSRIs are considered to be very, very safe drugs. In terms of side effects, the only ones that I've been taught are things like they make you feel a bit sleepy, and they can cause sexual dysfunction in a very small minority of patients, and this is tiny. Whereas tricyclic antidepressants, they are somewhat more toxic in the sense that they can cause cardiotoxicity, so they make your heart rhythms go a bit funny. They could potentially cause seizures. They can cause postural hypotension, so it just means your blood pressure goes down when you sort of get up. They can make you get a bit of a fever. They're not really used that often, but because you start on a very low dose anyway, you don't really, the side effects aren't really more to do with those doses, they're more to do with the higher doses that are used. If you've got any questions about this, please feel free to leave questions in the comment section below. Send me a message on Twitter, on Facebook. I'm happy, doing whatever. But for now, thanks for watching.